A very good evening all. I am Aditi Lamba with the Thursday night edition of South Asian News, Vision of Asia. We are coming to you from our studio in New York City. Welcome to the show. Let's start with the biggest news of this week. President Joe Biden has been sworn in as the 46th President of the United States, along with Vice President Kamala Harris making history as the first woman of color Vice President. Today, President Joe Biden launched initiatives to rein in the raging COVID-19 pandemic, tackling his top priority on his first full day in the White House as he tries to turn the page on former President Trump's leadership. President Biden has signed a series of executive orders related to the pandemic, including requiring mask wearing in airports and on public transportation, including many trains, planes, and inner-city buses. The executive orders also include halting the withdrawal from the World Health Organization, as well as issues such as rejoining the Paris Climate Accord and ending travel ban on some Muslim-majority countries. The new administration plans to coordinate federal coronavirus response aimed at restoring trust in the government and focused on boosting vaccines, increasing testing, reopening schools, and addressing inequalities thrown up by this disease. On coronavirus pandemic updates, globally, we are at 96.2 million cases of COVID-19 with more than 2 million deaths. In the United States, we have surpassed more than 406,000 deaths with at least 24.5 million cases of coronavirus. Today, nation's top medical advisor, Dr. Anthony Fauci, said that the United States will cease reducing U.S. staff counts at the World Health Organization and vowed to stay fully engaged with the UN Health Agency to help fight coronavirus. The director of the Centers for Disease Control and Prevention announced that the eviction moratorium will be extended till March 31st, protecting as many as 40 million Americans from displacement. The new CDC director, Dr. Walensky, has said that we must act to get cases down and keep people in their homes and out of congregate setting where COVID-19 can take even stronger foothold. So what is the solution to current surge of cases and deaths reaching high records, and how should the vaccine rollout speed up? We have tonight health experts, doctors and others on the South Asian News segment, bringing the voice of community in politics, media and culture. Here are the headlines. Dr. Anuj Vohra on surge in coronavirus cases and COVID-19 vaccines, Connecticut. Dr. Sandeep Jain discusses COVID-19 vaccine rollout program, StatCare urging walk-in medical care, New York. Get to know Marvel Studio presents WandaVision original series featuring Liz Olsen, Paul Bettany and Matt Shakman. It's time for a short break on Vision of Asia, Voice of the Community. We'll be right back. And welcome back. I am Aditi Lamba and this is Vision of Asia, Thursday night episode of South Asian News. Let's take a look at the coronavirus pandemic's measures and updates. Newly sworn in President Joe Biden has put the disease top of his daunting list of challenges, including rebuilding a ravaged economy and addressing racial justice. On that, President Biden has signed a slew of executive orders to tackle the coronavirus pandemic by ramping up vaccinations, expanding testing, and reopening of schools. On vaccine, the new administration is still figuring out a national strategy to get these vaccines to most Americans. Recently, Amazon extended an offer to the president to assist with national distribution of COVID-19 vaccines, a move that could expedite the federal effort to combat the pandemic. Also on vaccine, the president has pledged to provide 100 million doses of the COVID-19 vaccine during his first 100 days, and plan aims to increase vaccinations by opening up eligibility for more people such as teachers and grocery clerks. Nation's top health expert Dr. Anthony Fauci has said that he's still optimistic that we can get 100 million doses in 100 days. So what is slowing down this vaccine rollout and what is needed to help overwhelmed healthcare system? We spoke with Dr. Sandeep Jain, who brought much insight into the ongoing vaccine rollout and where the nation currently stands in vaccination program. Here is Dr. Sandeep Jain. In the United States, we are at 24.5 million cases of COVID-19 and at least 406,000 deaths. My question to you is, why do we continue to see this surge and why aren't we able to contain it in certain parts of the nation right now?
Well, it's almost like the horse has left the barn. Right now we have community spread. The only way that you can prevent it is by two people wearing a mask. Just as an example, if there's a patient who has COVID, he or she wears a mask, there's almost a 74% reduction in transmission. And if the person opposite him or her is wearing a mask, there is almost 99% reduction in transmission. So masks are the most effective way of preventing transmission. And if feel that if everybody does it, from here on, the curve will actually come down.
Let's talk a little bit more about the vaccine. There is Pfizer, there is Moderna, there's AstraZeneca that's waiting, there's Johnson & Johnson. How are you looking at these vaccinations and how do they sort of differ? And also a question to you following that, Johnson & Johnson's vaccine is going to be one dose only. Do you think that'll be more effective in getting to more people in the country?
So there are two parts to your question. Let me answer the first one. Yes, there's a Moderna vaccine and a Pfizer vaccine, and there's significant differences in both. My personal preference was for Moderna. However, the hospital didn't have it, so I got what was available. And there is a reason for it. Moderna first dose, the efficacy is upwards of 90%. Pfizer, the first dose efficacy is upwards of 50%. I'm a frontline healthcare worker. I wanted to be vaccinated with a 90+% efficacy between the two doses. Now, after the second dose, both vaccines are similar, 90+% efficacy. So that's about Moderna and Pfizer. The second big reason I wanted Moderna, I know it's made in America. It's made by a very innovative company.
Right.
So I would rather support American jobs. The second part of your question about Johnson & Johnson being a one-dose vaccine, I think it certainly will help. However, the key would be something like Novavax or any vaccine that comes out that can be stored in a regular refrigerator, does not need such cold chain requirements, and can be mass distributed in rural areas and far and flung areas in the world. Because remember, it's not just America that needs to be vaccinated. As long as there's still people out there in the world that are not vaccinated who end up coming here or any other country, will keep having this disease.
You know, doctor, I have to ask you now, before I go into more about what is the vaccine doing and what are the side effects, the rollout for the vaccine is incredibly slow in the country right now. I want to know what your personal experience has been with your urgent care centers and why are we having no national plan for this?
So I think we're living in the midst of chaos. A lot of decisions will not go right. And I think that's okay. All of us should accept that. I think Governor Cuomo has done a great job at distributing the vaccines. In the first phase, they distributed to the hospitals. Unfortunately, hospitals weren't able to get them out as much. And you can hear Mr. Cuomo's response to that. I feel a lot of people in the community were too scared to go into hospitals that have COVID-infected patients. I wouldn't want my mother to be going into the hospital to get a vaccine either. So I think that's predominantly been the challenge. The second challenge has been at a national level. It's very hard to coordinate such a huge event in the midst of a changing presidency, changing government. However, I do think President Biden and Kamala Harris will have a very good plan for all of us.
Right. You know, President Biden has vowed to the country right now that he would, try to get 100 million doses given in the first 100 days. That means 1 million every day. Do you think that's possible?
It depends. I do believe that's a very noble aim to aim for. I can just tell you my personal experience. We got about 1,700 doses. What we did was when we opened them up on the New York State website, the spots were getting filled up very quickly. As you would know, that's the same situation nationally. We also reached out to community groups, religious groups, told them, listen, you need to get your elderly all in one place and we'll come out in the community and vaccinate you. And we were able to finish more than, I think, 95% of our shots.
Wow.
In 4 days, and by the 5th day, we're almost done.
Wow. So are you currently out of vaccine, doctor?
I think today probably my offices might have the last doses being given. And we are hoping, and we've been promised by the state to get us more shots. So our mobile medical van is still in the shop because we don't have vaccines to go out and distribute in the community.
What are you expecting as the timeline for the next doses?
So we didn't get last week and we didn't get the vaccine this week. We were supposed to get a weekly supply. My concern has been when they distribute all the shots, I hope they hold on to the second doses because that's the only way it has been studied to work. And I would want to keep my word with my patients and all the community elders that we've actually given them the first dose, that I would like to go and give them the second dose. The state has told us they're holding the second dose for us. Once we get it, we'll distribute the second dose to people who already got the first dose.
So currently, none of your patients have had a second dose of the vaccine?
No, unfortunately, not yet. But very soon. I'm very excited for them.
And would it give you enough time? I know there has to be a certain time in between taking the second dose. Would that be affected?
So for the Moderna vaccine that we have, you need a 4-week interval. So we started distributing. We finished it last week. So 4 weeks from then, we'll go back and give the vaccine as long as we get it from the state.
All right, doctor, also, when we're talking about vaccine, I have to ask you, what are the side effects that you personally felt after getting your first dose and your second dose? And what are you seeing amongst your patients as common side effects?
So the commonest side effect that I've seen in patients as well as myself, you feel a little tender spot. If you touch it where you got the vaccine, it hurts. The next day, you'll feel it a little bit more, nothing that Tylenol cannot cure. And the other common side effect, which isn't common, I would say, it's one of the side effects that we heard from patients. Some of them felt a day of fatigue. Very rarely, and we've had only 1 or 2 people, they actually had a little bit of a rash on their arm, which went away over the next 2 or 3 days. Those 3 are the commonest things that we found. I mean, again, one is very common, which is, I think, almost everybody has that local pain. And the second side effect, fatigue, which is in a small subset of patients. And the third is rarely we'll find a rash.
We have also heard that most patients are showing more of those signs of fatigue or fever after their second dose. Your comments?
So I think if you take the entire number of vaccines being distributed, the people who get the side effects, they'll be vocal, and that's what will be carried by news media as well. I think if we put it into perspective to the number of doses being given out, it's a very, very small number.
More on the pandemic. Coronavirus has infected more than 24.5 million people in the nation and has killed more than 406,000, the highest totals in the world. CDC, the Centers for Disease Control and Prevention, predicts that there could be as many as 100,000 more COVID-19 deaths by mid-February, bringing the number of deaths to more than 500,000. Yesterday, the nation reported more than 4,000 deaths, only the third time ever to cross that threshold, and saw more than 178,000 new COVID-19 cases. On this toll of the pandemic, new CDC Director Dr. Rochelle Walensky described it as truly heartbreaking, but said that healthier days lie ahead. Many states are surging with COVID-19, where hospitals are overwhelmed and are running out of PPE and intensive care unit beds. In vaccine, only 16.5 million shots have been given out of the distributed almost 36 million vaccine doses. States are appealing for more vaccine as the demand is outpacing the supply. And health experts are urging Americans again to continue following the CDC guidelines, especially on wearing the mask. Discussing this ongoing surge and the issues with the vaccine rollout, we spoke with emergency room expert Dr. Anuj Vohra. Urging all to stay vigilant, here is Dr. Anuj Vohra. Currently, we're looking at almost 25 million cases in the United States with at least 406,000 deaths. My first question to you has to be, why do we continue to see this surge across the nation? Why aren't we able to control it?
Well, one of the challenges is after the holidays, people get together, or during the holidays, I should say, people get together and they don't follow the recommended guidelines of making sure that we're keeping our social distance and keeping gatherings limited to a small amount of people. Because of the lack of follow through with the recommendations, we're seeing higher spikes than ever before. We're hoping now that New Year has passed, that the holidays have passed, that the numbers will now start to decline, hopefully as early as next week. But I think that's part of the challenge that we've had so far.
You know, I have two follow-up questions to that. My first question is, we're seeing anywhere around 4,000 deaths a day. When do you predict this number dropping?
It's tough to tell. I think a significant drop will occur, of course, once we all get vaccinated. And right now, healthcare workers are being vaccinated. People over the age of 75 and even 65 are being vaccinated. So as we progress with the vaccination plan, we're going to see a significant decline in numbers. I myself just received my second vaccine yesterday, which I would strongly recommend for anyone that's being offered the vaccine. But once we get the vaccine out to the mass public, we'll see a significant drop in numbers.
Yes, for sure. Dr. Vohra, there's another prediction from CDC which says they may be predicting around 500,000 total, so another 100,000 deaths in the nation until mid-February. Your comments?
It's certainly a possibility. You know, COVID affects those with multiple medical problems the most, especially those with lung issues like COPD, emphysema, diabetes. So that is certainly a possibility of seeing that amount of deaths, but things are going to get better as this vaccination is distributed.
How is currently currently the condition of hospitals across the nation, Dr. Vohra, and how is it in the ER that you are part of 2 ERs, as I'm aware? How is the situation there? What are you seeing on a daily basis, and how does it differ from, a state like California where hospitals are super overwhelmed?
So I think ERs all across the country are overwhelmed. I think California is especially in a difficult spot because of the significant and enormous numbers that are challenged with there. With that said, even here in Connecticut, our ED is often full and our hospital is often full with inpatients that have multiple comorbidities, but many of them have COVID and are COVID positive. So we're seeing a huge number of COVID admissions throughout the country, which is causing hospitals to be full and hence falling into the ED's hands, where we have what we call inpatient holds, which are patients that would routinely be on inpatient floors that are being held in the ED. This makes a bigger challenge for emergency doctors and emergency staff to care for acute patients coming in. So we're trying to do the best we can, especially here at Hartford Healthcare, to care for these patients that come in, but it is a very significant challenge.
What is the current status of PPE, ventilators, and as well as ICU unit beds in your 2 hospitals that you're working at?
So most of the time, our ICU has been pretty full. Our PPE, luckily, is fine. We're one of the fortunate systems that has not had a shortage of PPE, but all throughout the country, there are multiple systems and hospitals that haven't had enough to safely protect their staff, which is just so sad and unfortunate. But most hospitals have gone into an aggressive mode of purchasing PPE, and I think we're doing a whole lot better now versus where we were in the beginning of COVID, which is almost a year ago now, pretty much. But it still continues to be a challenge based upon your geography.
And it's time for another short break on Vision of Asia, Voice of the Community. We'll be right back. And welcome back. I am Aditi Lamba, and this is Vision of Asia, South Asian News segment. We have now a Get to Know segment featuring the cast and director of new series WandaVision. Presented by Marvel Studios, WandaVision is an original series based on the Marvel Comics character Wanda Maximoff, Scarlet Witch, and Vision. The series presents superpowered beings Wanda and Vision who are living idealized suburban lives but then begin to suspect that everything is not as it seems. Directed by Matt Shakman and written by Jack Schaffer, the original series blends the style of classic sitcoms with Marvel's cinematic universe. WandaVision is streaming on Disney Plus, and we have tonight snippets from a press junket featuring stars of the series Liz Oslin, Paul Bettany, and director Matt Shakman. Here's why you should watch WandaVision.
Heavenly shades of night are falling. It's twilight time.
Wanda and Vision, aren't we a 5-pair?
This is our home now. I want us to fit in.
Oh, this is gonna be a gas!
Where did you 2 move from? How long have you been married? And why don't you have children yet?
Our story.
I think what my wife means to say is that we moved from...
Moved from where? Married when? Damn it, why?
Oh, Arthur, stop it. Stop it. Stop it. Stop it.
How did the 9-episode series format allow you and Lizzie to explore your characters?
So when you're making these big movies, Avengers and so forth, Civil War and all of that, there are so many characters that necessarily your time on screen is curtailed, and you're having to pack an awful lot into a very short amount of screen time. Whereas there's something really expansive about this many hours of television that allowed Lizzie and I to really drill down into each of our characters and also their relationship, and that was it was a really fun time.
Sorry, what did you think when you first heard about the concept for WandaVision?
When I first heard about the concept for WandaVision, it was with Kevin Feige and Lou Esposito, and I immediately just thought it was going to be a very fun and challenging way to tell a story. It's an amazing opportunity to kind of reinvent the wheel. And we get to challenge new audience members, hopefully, who don't know Marvel as well. And then we get to challenge our fans to watch a story unfold in a totally different way, but it is still 100% MCU through and through. But yeah, I immediately fell in love with the idea the moment I heard it.
This is really happening.
Like days of old, lighting the spark of love that fills me.
Am I dead?
No. Why would you think that?
Because you are.
Explain how you came to WandaVision with both a directorial and an acting background in sitcoms.
It seems kind of wonderfully inevitable that I ended up directing WandaVision because I grew up as an actor on sitcoms. I was on backlots and sound stages my entire childhood, but also as a director now as an adult, I do both comedy and drama and action and VFX stuff. So this project was a really wonderful melding of both my personal history as well as all the different things I love to do professionally.
Can you describe the efforts behind the scenes, from costumes to production design to dialect coach, to ensure the classic style was authentic throughout each era?
We were very careful in our attention to detail. We wanted to make sure the palette was accurate for each era and each show, that the red in the 70s was the actual red we wanted. We looked at dialect coaching and coaching about just sort of physical presence, like how do you sit, how do you stand in different eras. Obviously wigs, hair was really important. Costuming using vintage fabrics. Our costume designer, Maya Rubio, did a brilliant job recreating these eras, but also making them feel very focused on Wanda and Vision as characters. And our production designer had to design basically the same house, both inside and out, in multiple different eras. So it's the same house, it's just changing with the style of the different eras.
And what is the benefit of this story being shared via Disney Plus versus on the big screen?
The big screen stories are amazing, but in 2 hours, you have a limit to how deep you can go into telling a story. But with WandaVision, we're able over 9 episodes to go really deep into Wanda and Vision's relationship and to hopefully move them forward into a place where, one or both can venture off into other MCU properties.
Unusual couple, you know.
Oh, I don't think that was ever in question.
And this wraps up our show for the night. Please send us your suggestions and get your voices and organization on our show. Email us on events@itvgold.com or follow us on Facebook @itvgold. You can also subscribe to our YouTube channel for free access to many of our popular shows. Thank you for joining us tonight from Queens, New York. This is Vision of Asia, and I am Aditi Lamba. Take care and be well.